You've probably been told that persistent phlegm means you still have a cold, that it's just allergies, or that it's normal at your age. Those explanations sound harmless, but they miss the real story. Phlegm isn't a random nuisance, it's a signal. Your throat and airways are lined with a living, self-cleaning carpet of tiny cilia floating in a thin layer of fluid. Their job is to sweep a protective blanket of mucus toward your stomach, 24 hours a day. When that conveyor belt slows because the lining is irritated, dehydrated, inflamed, or constantly splashed by stomach contents, the mucus thickens, pools, and lingers. You feel it in the morning, in quiet rooms, after meals, or every time you lie down. The real cause in most people over 60 is not one single disease hiding in the shadows. It's a pattern. Dry air plus irritated lining plus sluggish cilia, often amplified by silent reflux and age-related changes in the nose. The good news is that patterns can be changed. Tonight I'll show you how to read the message your body is sending, how to calm the irritation, how to rehydrate the conveyor belt, and how to reclaim a quiet, clear throat with simple science-backed habits you can actually live with. Let's begin with what phlegm really is. Your body produces mucus on purpose. Think of it as protective gel with a job description. Trap particles, neutralize invaders, carry them away. In a healthy system, you barely notice it because it's thin and constantly cleared. The sensation of phlegm in the throat appears when production rises, when clearance drops, or both. Production rises with inflammation, dust, pollen, cold air, smoke, infections, and chronic irritants tell the glands to make more. Clearance drops when the airway surface liquid dries out, when cilia tire, when you mouth breathe at night, when a deviated septum or turbinates narrow the passages, or when reflux quietly irritates the voice box and thickens secretions. Over time, those factors teach your body to live in a state of low-grade congestion. You clear your throat after every sentence, sip water constantly, and wonder why mornings feel like you swallowed glue. Age changes this system in predictable ways. After 60, the nose is more likely to swing between dryness and drips. Clinicians sometimes call one version non-allergic or vasomotor rhinitis. The nerves that regulate blood flow inside the nose become jumpy. A blast of cold air, a fragrant cleaner, a glass of red wine, or a hot soup can switch the faucet on. At the same time, many common medications nudge you toward dryness. First-generation antihistamines, some bladder and mood medicines, and even certain sleep aids dry mucous membranes and thicken secretions. Add indoor air that's kept warm but dry, a habit of talking for long stretches without water, and nights spent breathing through the mouth because of congestion, and you have the perfect recipe for sticky morning phlegm. Silent reflux, also known as laryngopharyngeal reflux, quietly magnifies the problem. It often doesn't burn. Instead, it sprinkles the voice box and throat with acid and enzymes, which inflame the tissue that's supposed to direct air, sound, and swallowing. The body responds by making more mucus to protect itself. People describe a lump in the throat that isn't there, globus, hoarseness that is worse in the morning, constant throat clearing, and the sense that something is stuck just behind the tongue. Even if you rarely feel heartburn, late dinners, large evening meals, reclining soon after eating, and extra weight around the midsection can push reflux up into the throat. Over months, this turns into a cycle. Irritation begets mucus. Mucus begets throat clearing. Throat clearing irritates the lining further, and the cycle keeps feeding itself. Allergies have their own fingerprint. If you wake with a stuffy nose and itchy eyes in certain seasons, if dusting the bedroom brings on sneezing fits, if a friend's cat makes your voice nasal within minutes, those are classic allergic triggers. The lining swells, glands shift into high gear, and the excess drains down the back of the throat. Some people call everything postnasal drip, but the modern way to look at it is simpler. It's inflammation-driven mucus plus impaired clearance, usually from the nose and sinuses upstream. The remedy is not to stop mucus entirely. That would be like removing oil from an engine. but to quiet the inflammation and restore the conveyor belt. Smoking, and even living around smoke, adds a tougher layer. Cigarette smoke transforms the inner surface of your airways, increasing the number of mucus-secreting cells and flattening the army of cilia that should be sweeping that mucus upward. This is why chronic bronchitis is defined by months of daily phlegm, year after year. If you smoked for decades, your airways learn to make more mucus and move it less well. The shift doesn't reverse overnight, but the body still listens to better signals. Cleaner air, consistent movement, and airway-friendly habits reduce production and help clearance, even after years of irritation. Infections get blamed for everything, but most people with weeks or months of throat mucus aren't dealing with a lingering germ. After a cold or flu, it's common to have a month or more of inflammation-driven mucus as the lining recovers. If that recovery window overlaps with dry air, reflux, or unmanaged allergies, the post-viral phase can stretch on. The key is to support clearance and calm the lining, rather than reaching again and again for antibiotics or medicines that dry you out and make the mucus thicker. Hydration earns its own paragraph because mucus runs on water. The cilia that sweep mucus forward need a thin layer of fluid to move. When you're dehydrated, or when the air you breathe is bone dry, the periciliary layer shrinks. Mucus becomes rubbery and resistant to the cilia's push. You feel this as strings that don't want to move and as a constant urge to clear your throat. That urge matters. Aggressive throat clearing slams the vocal folds together and actually inflames the tissue more, which makes everything worse the next hour. The replacement habit is gentler and more effective. Sip, swallow, breathe. Small sips of warm water or non-acidic tea, a deliberate swallow, 2 slow nasal breaths. Repeat. It interrupts the loop and protects your voice while the lining recovers. Now that you understand the pattern behind persistent phlegm, here's the part most people find empowering. One natural, evidence-supported practice can reverse several parts of the problem at once, and you can do it at home safely. That practice is high-volume saline irrigation of the nose and sinuses, what many people call a rinse or a wash. Done correctly, it hydrates the conveyor belt, thins secretions, carries allergens and dust out, and reduces the inflammatory signals that keep glands on high alert. Think of it as a daily shower for the surfaces upstream of your throat. If you've never used a rinse, here's the simplest way. Choose a squeeze bottle or neti pot designed for nasal irrigation. Mix the salt packets that come with the kit in sterile, distilled, or previously boiled and cooled water. Lean forward over a sink and let gravity help the saline flow in one nostril and out the other. Gently blow, then repeat. Go slowly. Lukewarm solution is more comfortable than cold. If your nose burns, increase the salt concentration slightly. Too little salt stings more than enough. Once a day for a few weeks is a good start. Some people prefer morning and night, especially during allergy season. Why commit to a rinse? Because each benefit solves a different part of the pattern. First, a rinse mechanically removes allergens, pollutants, and dried secretions, so you start the day with a clean field. Second, it restores moisture where cilia work, letting them beat effectively and carry mucus forward instead of letting it puddle in the back of your throat. Third, regular irrigation reduces swelling in the nasal lining, which opens space and improves airflow. That makes mouth breathing less likely at night and reduces morning glue throat. Fourth, when the nose is open, you breathe through your natural humidifier and filter. Your throat gets air that's warmer and moister, which means less irritation. Fifth, for people with chronic sinusitis, rinsing helps wash away thick secretions and biofilm, improving the delivery of any medicines your clinician prescribes, like steroid sprays. Sixth, rinsing forces you to pay attention to technique and hygiene, using sterile water and cleaning the bottle, which protects you from rare but serious infections and keeps the practice safe. Seventh, it becomes a small ritual that anchors other airway-friendly habits. You'll find yourself sipping water after, taking a 10-minute walk to get the cilia moving, and noticing how late meals affect your morning throat. Speaking of safety, the water you use matters. The nose is not the stomach. It can't kill germs with acid. Always use distilled or sterile water, or tap water that you have boiled for at least 1 minute and cooled. Clean and air dry the device after each use. This isn't about fear, it's about respect for a powerful, helpful ritual that works when done right. If irrigation is the centerpiece, here's the rest of the orchestra that helps it sing. Calming silent reflux protects your voice box from the chemical irritant that keeps mucus glands revved up. The basics are practical. Finish dinner 3 to 4 hours before lying down. Avoid reclining after evening snacks. Raise the head of your bed by 6 to 8 inches or use a quality wedge pillow. Reduce late-night portions. And notice your personal triggers. For many people, the villains are large fatty meals, chocolate, peppermint, onions, alcohol, and acidic drinks close to bedtime. For others, it's the timing and the volume more than the food itself. When you put gravity on your side and give your stomach time to empty before you recline, you give your throat a quiet night instead of a chemical bath. Humidity is the third lever. In cool or air-conditioned climates, indoor air often sits between 20% and 35% relative humidity in winter and runs dry year-round in some homes. Your airway lining prefers a moderate zone. If your eyes, lips, and throat feel parched at home, consider a simple humidifier in the bedroom set to a safe, clean 40 to 50% relative humidity. Clean the tank regularly. Combine that with the nose-first breathing you'll regain as rinsing opens your passages, and you'll notice that the morning cement softens. Now let's talk about medicines, because this is a place where good intentions often backfire. Over-the-counter decongestant sprays that promise instant relief, like oxymetazoline, do shrink swollen nasal tissue fast. But if you use them for more than a few days, the nose can rebound and become even more congested than before. That rebound can lock people into months of dependency and, ironically, worse mucus and mouth breathing. If you've already fallen into that pattern, there are ways to taper off with guidance from a clinician and to switch to treatments that don't boomerang. Oral decongestants like pseudoephedrine can raise blood pressure and heart rate and worsen urinary symptoms in men with prostate enlargement. The old-style antihistamines, diphenhydramine, chlorpheniramine, and friends, are drying, sedating, and on lists of medicines to avoid in older adults because they can fog thinking and worsen balance. They thicken mucus while making you feel drowsy, which is the opposite of what you want. If you truly have allergies, a modern, non-sedating antihistamine taken consistently during your season, paired with a daily intranasal steroid spray and regular saline rinses, targets the mechanism without gluing your throat. If your main problem is watery drips triggered by temperature changes or fragrances, your clinician may consider an anticholinergic nasal spray that reduces the drip without drying your whole body. If you take an ACE inhibitor for blood pressure, medicines like lisinopril, know that a persistent throat tickle and cough can be a side effect. It doesn't create phlegm, but the constant urge to clear your throat can make mucus feel worse. If that pattern started after a medication change, ask whether a switch is reasonable for you. Because the internet never sleeps, let's clear up popular myths. Milk does not increase mucus production in the airways. For some people, the texture of milk can feel coating in the mouth and throat, and the brain interprets that as more mucus. But studies don't support the idea that dairy creates a new flood of secretions. If milk upsets your digestion, or you simply feel better without it, that's fine. Choose what works for you. But you don't need to ban yogurt if your main concern is throat phlegm. Another myth is that you can cough it all out. In reality, the most effective way to clear stubborn mucus is to mobilize it. Hydrate the lining, restore nasal breathing, move your body, and let cilia do their job. 10 to 15 minutes of easy walking after meals increases blood flow and ciliary activity. Gentle humming through the nose for a few minutes can help open the connection between nose and ear and vibrate secretions forward. It sounds silly, but it's a friendly nudge to your conveyor belt. Warm showers, a mug of non-acidic herbal tea, and a quiet bedroom are not placebos. They are the environment your physiology was built for. You may be wondering, when should I worry? Here are the red flags that deserve timely evaluation rather than home care alone. Phlegm streaked with blood that isn't from nosebleeds. Unintentional weight loss. Persistent fevers, night sweats, or chest pain. Hoarseness that lasts longer than 3 to 4 weeks. difficulty swallowing that makes you avoid food or liquids, shortness of breath at rest, a new daily productive cough if you are a current or former smoker, and a change in voice or neck lumps. Most persistent phlegm is not a warning sign of something sinister, but those particular features should prompt a clinician to look more closely. A chest X-ray, spirometry, or a look at the voice box may be the right next steps in those scenarios. Let's make all of this practical with a 7-day phlegm reset you can start tomorrow. Day 1, morning. Set up your nasal rinse with sterile or boiled and cooled water and do 1 gentle wash. Then pour a glass of room temperature water and sip steadily through the morning. If you drink coffee or tea, enjoy it, but pair it with water. Caffeine is fine for many people, but your cilia need hydration. After lunch and dinner, take a 10-minute stroll, indoors or out. Day 1, evening. Finish dinner 3 hours before bedtime. If you snack, make it small and not acidic. Elevate your head for sleep with a wedge or blocks under the bedposts. Day 2. Add a second rinse if your nose still feels stuffed. Begin a gentle voice rule, where you avoid frequent throat clearing. Replace it with the sip, swallow, breathe pattern. Day 3. Check your bedroom humidity. If your lips and throat are desert dry on waking, add a small humidifier and clean it every 2 days. Day 4. Identify one fragrance, cleaner, or trigger that makes your nose run, and swap it for a fragrance-free or hypoallergenic alternative. Day 5. Weather permitting, spend 15 minutes outside in fresh air and practice nasal breathing during a relaxed walk. Day 6. If allergies are part of your life, wash your pillowcase and start rinsing in the evening too, so you go to bed with clear passages. Day 7. Review any over-the-counter medications you've been using for congestion. If a rebound-prone spray has snuck into your routine, plan a taper with your clinician or pharmacist and replace it with safer daily tools. Rinses, a steroid nasal spray if advised, and consistent hydration. Stories make this more real. Picture Elena, 72, a choir volunteer whose voice began to feel fuzzy, with thick strings in the back of her throat every morning. She had no heartburn, so reflux wasn't on her radar. Her clinician noticed that her dinners had grown later and larger since she started helping with an evening grandchild routine. Elena shifted her main meal to midday, used a wedge pillow, and began a nightly nasal rinse. 2 weeks later, the morning strings softened. She didn't become a different person. She changed 3 precise levers. Or think of Daniel, 66, a retired carpenter who used over-the-counter decongestant spray for months each winter because it worked. He woke every day with a mouth like sandpaper and a throat he had to clear before speaking. With a taper plan and a switch to saline irrigation, a steroid nasal spray, and a second-generation antihistamine during his pollen season, he escaped the rebound loop. His morning phlegm shrank from a page in his day to a comma. Meet Rosa, 69, who doesn't tolerate dairy and was convinced it was the source of her mucus. When she learned that the culprit was her dry bedroom and the reflex throat clearing she did all day, she added a bedside humidifier, practiced the gentler swallow pattern, and set a timer to sip water every hour. Her voice steadied, and she returned to reading aloud to her grandchildren without stopping to hack. Finally, consider Marco, 74, a lifelong smoker who quit at 70. He still had daily phlegm and felt discouraged. A respiratory therapist taught him an airway clearing technique, breathing out through pursed lips and doing a gentle huff to move secretions without violent coughing, paired with morning rinses and a walking routine. Marco didn't erase a lifetime of smoke, but he regained control. His cough grew productive in the morning and quiet the rest of the day. He started to plan morning walks instead of planning around phlegm. Because viewers always ask for specifics, here are clear, safe formulas you can use. For a throat-soothing sipper, steep a mug of warm water with a slice of fresh ginger and a pinch of thyme. Add a teaspoon of honey if you like and if your blood sugar allows. Avoid lemon at night if reflux bothers you. The warmth hydrates and encourages gentle swallowing without adding acid. For the rinse, use the salt packets that come with your device, or make your own isotonic solution by dissolving a level ½ teaspoon of plain salt and a pinch of baking soda in 8 ounces of sterile water. Never tap water straight from the sink. For bedroom air, aim for moderate humidity and regular cleaning rather than tropical levels. Too much humidity can promote dust mites and mold, which worsen allergies and, you guessed it, mucus. For movement, set a tiny after-meal rule. 5 minutes is acceptable, 10 is ideal, 15 is a gift. This is not about breaking a sweat. It's about sending a move mucus forward message to your cilia 3 times a day. Let's also protect your progress by avoiding common traps. Don't chase quick-fix pills that promise to dry you up. Drying the lining may buy an hour of quiet, but costs you a day of thicker secretions. Don't depend on oral phenylephrine pills. Despite their popularity, they're not effective decongestants, and counting on them keeps you from using methods that work. Don't let a friend's advice to just take Benadryl push you into a fog. Older bodies handle those medicines poorly, and there are safer options. Don't ignore your sleep position. If your mornings are the worst, gravity is part of the story. Don't let dehydration sneak in because you don't want to get up to pee at night. Front-load your fluids earlier in the day and taper after dinner instead. And don't beat yourself up if you've been throat clearing for months. The reflex is powerful. You'll replace it with a gentler pattern, and the lining will calm with practice. Some people ask about supplements. The truth is simple. The best mucolytic for most older adults is water delivered to the right places: your bloodstream, your nose, and your room air, combined with motion. N-acetylcysteine can thin secretions in certain lung conditions, and your clinician may consider it if chronic bronchitis or bronchiectasis is part of your picture. For garden variety throat phlegm, start with the foundations. If, after a few weeks of consistent rinsing, reflux quieting, hydration, and humidity, you still wake every day with stubborn secretions, that's a great time to check for allergies, to review your medications for hidden dryers, and to consider a look at the voice box to see whether silent reflux has inflamed the tissues that matter for your voice. What if you use a device like CPAP for sleep apnea? Those machines can dry your nose and throat without adequate humidification, and dry mucosa makes morning phlegm worse. Make sure your device's humidifier is on, filled, and set appropriately for your climate, and talk with your sleep clinician about fit and settings if you still wake parched. It's a perfect example of how the solution lives in the details. You treat one problem well and avoid creating another. If you live in a city with pollution or in a home where cleaning products and fragrances are strong, give your lining a break. Switch to unscented detergents and cleaners, avoid aerosols, and ventilate the kitchen when cooking. Consider a HEPA filter in rooms where you spend the most time if your budget allows. Small changes compound. The less your lining is insulted, the less it overproduces to protect you. You might be surprised to hear me talk about posture and movement when the topic is phlegm, but your body is one system. Gentle daily movement improves blood flow to the lining, encourages rhythmic breathing, and literally shakes secretions loose so cilia can carry them away. If you sit long hours, set a reminder to stand and stretch your ribs every hour. Hands on lower ribs, breathe into your palms for 5 slow breaths through your nose. This kind of subtle expansion prevents the stagnant chest feeling that tempts you to cough hard. If your back is comfortable, try a few minutes of lying on your side and taking deep nasal breaths before bed. It's a quiet way to cue the conveyor belt without irritating your throat. I also want to offer a voice-saving protocol for those who speak or sing often, because overuse plus phlegm can spiral. Start each day with 5 minutes of soft humming through your nose after your rinse. Keep sips of room temperature water at hand. Replace throat clearing with a gentle, silent cough. A slightly stronger exhale through open lips, followed by a swallow. Limit spicy, acidic foods close to performance or bedtime if reflux contributes to your mucus. And remember that a quiet voice is not a weak voice, it's a protected one. At this point, you might think, this is a lot to remember. So let me compress it into a storyline you can carry. Persistent phlegm after 60 is usually a hydration and irritation problem, not a mystery infection. The solution is to restore the conveyor belt and calm the lining. You do that by rinsing the nose with sterile saline, breathing through the nose more than the mouth, humidifying your bedroom sensibly, finishing dinner earlier and elevating your head, moving gently after meals, sipping water through the day, avoiding rebound-prone sprays and drying medicines, and checking for allergies or reflux if your pattern suggests them. You'll know it's working not because phlegm vanishes overnight, but because mornings get easier, throat clearing becomes an old habit you forget to do, and your voice feels like yours again. If you like a single line that keeps you honest, here it is. Thin the mucus, don't fight it. Move the cilia, don't punish your throat. That's the difference between a day built around clearing your throat and a day built around using your voice. As we close, pick your starting trio. Choose one moment for a rinse. Choose one reflux quieting rule, either earlier dinner or a wedge pillow. Choose one hydration anchor, like a 1-liter bottle you finish by mid-afternoon. Put the bottle and the rinse kit where you can't miss them. Tell someone who will cheer you on. In the comments, share which lever you chose and how it changed your morning. If you've lived with stubborn phlegm for months and turned it around, your story will be the nudge someone else needs. And if you want more practical, science-backed strategies for protecting your voice, your breathing, and your vitality in this stage of life, stay close to this community. Your airways are still responsive. Give them better signals, and they'll give you a clearer, calmer day.